What does it take to be a caregiver? If you are a caregiver, you may be able to answer that question. And if you're just helping out someone and don't realize that you are a caregiver, maybe you can't. I'm Pamela D. Wilson. Stay with me for the caregiving chat of the day. Helpful information for caregivers and aging adults is on my website at PamelaDWilson.com. In this video post, there is a link to my radio show from last week called How to Talk to a Parent with Dementia. This radio program and the transcript that you can read if you click on the link has information that's valuable for you even if you are not caring for someone with dementia. Great interview with Stephen Post. I'll share some of that information. So what is it like to be a caregiver? If you are an average caregiver, you are devoting about 20 hours a week on average to the care of an elderly parent. And that doesn't mean that you're showing up at their house. It could mean that you're making a phone call, you are having a telephone conversation with them, you're talking to a doctor's office, picking up prescriptions, all of that long list of things that caregivers do. So what does it take? It takes time, and more time as the health of your elderly parent or your spouse progresses. It also takes compassion, and compassion to the degree that we have to become so empathetic and so understanding of behaviors, especially of loved ones who have memory loss, that we can't understand. One of the most interesting things that Stephen Post said in this interview, again, the link is in here, you'll want to watch or listen to it. When I asked the question of, I have family members who say, I don't want to go see my mom or dad because they don't remember me. His comment was, it doesn't matter if you think they don't remember you. You have no idea what goes on in their head. You have no idea what they're thinking. And the fact that they don't remember you means they're having a hard time. People with memory loss struggle, especially at the initial diagnosis, because it's not like breaking an arm or breaking a shoulder and then you have a problem. When somebody has memory loss or dementia, there's no visual thing that happens in your head that you can see that there's a problem. What happens is you become forgetful, and you don't realize that you become forgetful, or you don't realize that you repeat information. So trying to make sense of Alzheimer's or dementia is impossible almost. It's this disconnect in a brain that happens that we're always not sure why, and that results in the person maybe not understanding that they have memory loss, and the caregiver having to be more understanding of this invisible thing in someone's head that is causing this need for care and this need for help and reassurance and behaviors and all of those things. So Stephen's post comment was, it doesn't matter if you think they don't remember you, they are still in there. Your mom, your dad, your spouse, they're still in that body that you're looking at. They're having a hard time coming out. So you are that person that can give them comfort. You are that person that maybe one day they'll say hello to you and they'll say your name because you remind them of something. So even if your loved one doesn't remember who you are, doesn't know you by name, you should still show up and visit. That is a common question that many caregivers will ask. It's like, why should I bother if they don't know? Well, that is more about you than about them. So more things about what does it take to be a caregiver, especially 24/7 caregivers. A lot of time, a lot of patience, and a lot of selfless care. So you are doing things that you never thought you would do. You may be changing depends, giving medications, taking blood pressures, taking blood sugars, giving insulin, doing things that used to be done in hospitals and nursing homes that now caregivers are doing today. It can be stressful, and that is one of the reasons that early on you want to do a couple of things. You want to become an educated caregiver, an educated patient if you are the older adult. Seek out education, become engaged in your care, ask questions. Don't take advice that doctors give you as, well, sorry, you're just old and this is what happens. It's no, what can we do about this to make it better? You want to be care-forward thinking caregivers and care-forward thinking elderly adults, because you don't have to be old and sick if you don't want to be. Now, it takes a lot of effort, not to do that because you have to exercise and actually take care of yourself. That would be called self-care. And that is the thing that caregivers are horrible at. Caregivers sacrifice their health, their well-being, their work life, their money to care for other people. And the question that nobody asks is, what happens to the caregiver after all of this? That is a question that should be addressed right up front. Yes, we're going to take care of mom or dad. Mom may be the caregiver, I may be the caregiver. Where are we after all of this? Is there money for mom's care? Have I left a job to take care of my parents and now I can't get back into the workforce? There are so many considerations about what it takes to be a caregiver. Helpful information is on my website, PamelaDWilson.com, in my Caring for Aging Parents blog, in all the videos here on Facebook. There are probably over 200. There are videos on my website. There is a caregiving library on my website. My radio show every Wednesday night called The Caring Generation, and my newly updated television channel on Roku TV called Caregiving TV. You can enter a source code to find it, or you can type in Caregiving TV to find it. But please do learn what it takes to be a caregiver. Do learn what it takes to take care of yourself. I'm Pamela D. Wilson. I'll see you tomorrow in another video.